I'm Dr. Namita, Gynec at Nivaran Hospital. Today I'm here to discuss a very small and important topic, antenatal checkup. Antenatal checkup is a systemic supervision of a woman during pregnancy to see the progress of fetal growth and to monitor the health of a pregnant woman. Now, what is the importance of antenatal checkup? Antenatal checkup help us in diagnosis of early complication in women like anemia, PIH, preeclampsia, in fetus, slow growth or growth retardation. A proper antenatal checkup help us to identify all these complications and to prevent the mother from having some serious outcome during pregnancies. Now, what are the timings when a person should have antenatal checkup? At least there are four recommended visits for a checkup. Like first is from early detection of pregnancy to 12 weeks. Second is from 14 to 26 weeks. Third is from 28 to 34 weeks, and the last is from 36 to term. These visits may vary, they can increase in number depending upon the health of the patient. Now, what is done in this antenatal checkup? First of all, a detailed history of the patient is taken. Like patient is asked whether this is her first pregnancy, what were her previous pregnancies were normal, whether there was any complication in the previous pregnancy like recurrent abortion, bleeding, and during delivery any PPH, EPH, or obstructed labor, whether the delivery was normal or cesarean section was done, and after the delivery whether the patient faced any complications or not. Secondly, in during this checkup, we ask about whether patient is having nausea, vomiting, heartburns, constipation, or any other thing which is facing. Then, third is we ask the patient, tell the patient about the expected date of delivery, what were the timings for tetanus doses. Then, after that, we do physical examination of the patient. Like in generally, if we see the pallor, BP, pulse, whether edema or jaundice or any small things which are generally missed by the patient. Then we take a examination, fundal height, whether it corresponds to the weeks of pregnancy. Then what is the presentation of the fetus. Then we auscultate the fetal heart sound. After this, we recommend some investigation which are very important like CBC, blood group, viral markers, urine RM, fasting sugar. After this, we come to the medicine point. Initially, up to 12 weeks, we provide folic acid to the patient. Then after 12 weeks, iron, calcium, vitamins, protein is recommended. Timely doses of tetanus is also recommended. In negative pregnancy, NTD is recommended. After that, the registration card to the of mother and the fetus is provided to the patient, in which the date of delivery is written. Tetanus doses, when the patient should be taking it, that is written. The patient next visit is also scheduled and also explained to the patient. So this timely management of all these 9 months is done during this antenatal checkup. So please, I recommend all the pregnant women to definitely go and visit to the nearby center for their antenatal checkup and get themselves registered. Thank you.